Hello, hello. My name is Jones, and today we are going to look at anxiety. Anxiety is a subjective individual experience that is characterized by a feeling of apprehension, uneasiness, uncertainty, or dread. Okay, so when you're looking at anxiety, it is the anticipation of future threats. It occurs as a result of threats that may be actual or imagined, misperceived or misinterpreted, or from a threat to identity or a threat to self-esteem. It often precedes a new experience. Okay, so some types of anxiety that we can talk about includes a normal anxiety, there can be acute anxiety, and there is chronic anxiety. Okay, so normal anxiety, this is a health type of anxiety that helps us to mobilize ourselves for action. Then acute anxiety, it is precipitated by imminent loss or change that threatens the sense of security. Okay, that is security to our personal identity, self-esteem, and the likes. Then we have chronic anxiety. This is anxiety that an individual has lived with for a long time. Okay, so let us now look at levels of anxiety. So we are going to discuss 5 levels of anxiety. Okay, so the names of these levels that we are going to discuss include mild or alertness level. Okay, so mild or alertness level, it is called as +1. We get as a level, it's +1 level. Then we have moderate or apprehension level, okay, which is +2. Then we have severe or free-floating level, which is graded as +3. Then we have panic level, which is graded as +4. Okay, so these are the 4 levels of anxiety that we are going to talk about. So we are going to talk about 4 levels of anxiety. So the first level is mild or alertness level, okay, which is graded as +1. So this is a type of anxiety that is associated with normal tension of everyday life. The individual is alert, perceptual field is increased, there is production, there is produce of growth and creativity, okay, that will increase, and also learning also will increase. In mild and alertness level, the person uses adaptive coping mechanism to solve problems and alleviate anxiety. So in the first level of anxiety, a person can use their normal coping mechanism to solve their problems or alleviate the uncomfortable symptoms that may come because of anxiety. So the nesting interventions here that can be done include recognizing the anxiety by statements such as, "I notice you being restless today," so that the patient can necessarily be aware of the anxiety within themselves. Or you can explore the causes of anxiety and also look at ways to solve the problems that cause anxiety, okay, by statements such as, "Is it possible that we can discuss of the things that are making you feel uncomfortable or uneasy today?" So like in this fashion, you'll be able to deal with the anxiety. Then there is moderate or apprehension level, okay, which is the +2 level. Okay, so in moderate or apprehension level, the response of the body to immediate danger and focus is directed to immediate concerns. There is narrowed perceptual field and narrowed attention, okay, which is necessarily to particular details. There may be selective inattentiveness, in the client, and there can also be increased tension that makes this person fail to learn properly. Okay, so whilst in normal learning, they can learn and perceive and also use the learning that they might have gotten from the challenge or the imminent challenge, and be able to cope normally using coping mechanism. In here, there is increased tension that affects learning. As a result, the person may use palliative coping mechanism. So in the normal, person uses normal coping mechanism, but in the moderate, they are going to use palliative coping mechanism. So some nursing interventions that can be employed here is providing outlets for anxiety, such as crying or talking. You can tell the clients it's all right to cry, okay, so that they can vent out and help to ease their feelings. Okay, so it is also important in order to avoid some tremors that come because of anxiety. You can encourage the patient to do some motor activities, as these help to reduce tension. Okay, you can also encourage the client to move from those things that are affecting their feelings and engage in more cognitive activities that may help them solve the problem or look at their problem differently. You can encourage the client to talk about their feelings and concerns, and also help the client to identify thoughts and feelings that have occurred prior to the onset of anxiety. So when one is having moderate apprehension level of anxiety, you can give, for +2, you can give anti-anxiety oral medication. Then there is severe free floating level, which is +3. Okay, so here in this at least level of anxiety, you create a feeling that something bad is about to happen, or you have a feeling of impending doom. So there is fight and flight response that sets in. There will be increased narrowed perceptual field that will occur, and focus is on specific details or scattered details, so that learning and problem solving becomes necessarily impossible. So in this level, which is learning and problem solving, that is level 3, learning is not possible, or learning cannot take place. Okay, whilst in level 2, we're saying there is mild inattentiveness that affects learning. Here, learning may not take place. So all behaviors are directed at alternatives that may help to relieve anxiety. So the individual needs direction so that they can focus on solving their problems. They may have dilated pupils, and they may also have fixed vision, okay, as they are having this problem. The person uses maladaptive coping mechanism. So in severe or free floating level of anxiety, the adaptive methods that can be used is maladaptive coping mechanism. Okay, so then the interventions that may follow is that do not focus on the coping mechanism that are there. You can encourage the patient to be calm, and also you can give short and explicit directions to the client so that they can easily follow the direction. You can modify the environment by setting limits or seclusions, and you can limit interaction with others and reduce environmental stimuli in order to help the clients to be calm. You can provide for severe, you can provide intramuscular anti-anxiety medication. Whilst for moderate, you can give oral. Okay, then for normal anxiety, you don't give any drugs. You just have to use coping mechanism. Then there is panic level, which is +4. So in panic level or +4, there is a feeling of helplessness and terror. the personality and behavior becomes disorganized, and the individual has lessened perception of environment to protect the ego from awareness and anxiety, causing distorted perception and loss of rational thoughts. Okay, so in level 4, if prolonged, the panic can lead to exhaustion and eventual death. So the person may use dysfunctional coping mechanism, may not have a proper mechanism necessarily to solve their problem. So they may have a non-functioning or dysfunctional coping mechanism. So in level 4, you can guide the patient step by step to action and restrain if possible because of risk of suicide or an accident that may land this person into death. Okay, so in our discussion, we have mentioned that anxiety, it is a vague and easy feeling of discomfort or dread that is accomplished by an autonomic response. So it's happening within it's happening as an autonomic response, okay, within the central nervous system. Okay, the source of anxiety may be non-specific or unknown necessarily to the individual. So a feeling of apprehension will cause anticipation of danger or causing this anxiety. So it is an alerting signal. That is, anxiety is an alerting signal that warns of impending danger and enables the individual to take measures to deal with the threat. Okay, so that is how we need to understand anxiety and also appreciate that it has got levels. So the types of anxiety, we have discussed that we have normal anxiety, we have acute anxiety and chronic anxiety. Then we have also discussed the levels of anxiety, which includes mild, okay, so that is mild or alertness level, okay, which can also be graded as +1. So it's just +1, +2, +3, +3, and +4. Okay, so these are the 4 levels of anxiety. So you label them as +1, 2, 3, up to 4. Okay, but +1 is what we are calling mild. So from mild to moderate, moderate to severe. Then the last one is the panic. Okay, panic. Then when we say mild, so mild has got another name, which is alertness level. Okay, mild anxiety, which is +1, has got another name, which is alertness level. When we say moderate, so from alertness, then there's apprehension. So the apprehension level. So alertness to apprehension. After apprehension, then there's free floating. So free floating is the severe form. Okay, so free floating, that is the severe form of anxiety, which is +3. Then there is panic level. So from alertness to apprehension, then free floating. After free floating, then there's the panic. Okay, so those are the levels. So in comparison of these levels of anxiety, we have looked at the characteristics of what we see in mild anxiety. We have looked at the characteristics that we see in moderate. We have looked at the characteristics that we see in severe and also in panic. So we looked necessarily at these characteristics, and then we also looked at the interventions. So the interventions for mild, we looked intervention for moderate, we looked at intervention for severe, and we looked at the intervention for panic level. So when we looked at all these in the mild, we looked at the characteristics that included that the individual is alert, perceptual field is increased. Okay, so here we are having an increased perceptual field. There is increased creativity, increased learning. Okay, so the person is likely just to use their adaptive coping mechanism. So the mechanism that will be employed here to avert the anxiety is adaptive type of coping mechanism. Okay, then the nursing interventions here is recognizing that yes, there's anxiety within the individual and exploring how to solve those perceptions that may have been created. Then there's moderate or apprehension level. In apprehension level, here, when looking at the response of the body to immediate danger and focus, here we're saying it's directed to immediate concerns. Then there's narrowed perceptual field, and the patient, the client's attention span is affected. So they may have selective inattentiveness, okay, and increased tension that may occur. So in moderate, the coping mechanism that will be employed is palliative coping. Okay, then how you deal with this? We discussed that you can provide an outlet, or you can tell a person to cry. It's normal to cry. Okay, it's normal to cry. You can tell them or encourage them to say, vent out. Even when you cry, it helps you to reduce the tension within the body. Then the severe. So in this moderate form, you can give oral anti-anxiety drugs as one of the nursing intervention. Then the severe form, you are going to give injectable anti-anxiety drugs. Here, person cannot necessarily learn, and their way of problem solving is very much affected, that they cannot solve their problems nicely. Okay, so then we moved on to panic level, where now personality is also affected, and you might need to support the patient throughout so that they can come out of this anxiety, because now it has become a mental issue, or it's now of a disorder which has affected their personality. So you may have to restrain the patient if necessary, so that they do not end up committing suicide, or they do not end up harming themselves or harming others. Okay, so necessarily these are some of the things that we have discussed about anxiety. So from me, I'm saying thank you and keep studying.